This is Joanna Gaffney, Program Specialist for Healthcare Authorities Interpreter Services Program. I will be walking you through how to submit a prior authorization for sign language requests. The purpose of this presentation is to show sign language contractors how to enter sign language requests into the ProviderOne prior authorization. We will go over each of the elements you need to enter a sign language request. Once you have logged into ProviderOne on the Provider Portal, select Online Prior Authorization Submission. From the Organization Unit drop-down menu, select 530 PA Sign Language, then select Next. If you accidentally select the wrong org, this could delay your payment when you submit your claim. In the Service Type Code selection box, select In Person from the drop-down menu. The next section is Client Information. This section is required. You will enter the client's Washington Apple Health number, including the WA, as well as the client's first and last name. The requester information is also a required section. The information that is being collected here is who is requesting this appointment and who is billing for this appointment. The requesting provider's NPI is a required field. This field must have the NPI of the healthcare provider who initiated the request for the sign language interpreter. The next field is the billing provider's NPI. This is also a required field. This will be the NPI of whoever is filling and submitting a claim for this job. This will be you as the contractor. This section is the service request information. The code qualifier will always be HCPCS procedure code. The national code identifies what the service line is. So for sign language interpreters, it will be T1013. The first modifier box will always be U3 to identify sign language. If the appointment is mental health or substance use disorder, a second modifier may be required. If the appointment has been identified by the requester as a mental health appointment, you must enter a U9 modifier in the second modifier position. Same for if the appointment is a substance use disorder appointment, but you will use U8 as the second modifier. The date of service or appointment date should be entered in the Processed From and Processed To section. This should always be the same date as the date of service. Number of units will be total time it takes to complete the appointment. This could include travel time. Once you have completed those entries, select Add Service Request Line Item. This will move the information you entered to the bottom of the screen and clear the Service Request Line Items area. If you find you have entered the information incorrectly, you can still edit the request. You simply select the Delete hyperlink that is showing in blue to remove the service line and re-enter it correctly. If you need to make any changes, you can do so by clicking on the blue hyperlink for the line number. Once changes are made, you will then need to select Update Service Request Line. Please note, this will be the only time that you will be able to make changes to your request, so please make sure all the correct information is entered for your request. You do not need to enter a diagnosis code. You can skip over this box. You will be required to choose a place of service, either office or home. The comments box must contain the ODHH service request number. Once you have finished entering the information, you will select the Submit PA Request Info button at the top left of this page. This is not the final submission of this request. This will identify any errors that need correction before the final submission. If you receive any red warnings at the top of the PA request screen, verify and correct the information. These corrections must be completed before ProviderOne will accept the online PA request. Once all information is corrected, the screen will advance to the submission screen. Here, you will receive a 9-digit reference number as verification. The PA request number is important to record. You will use this for any inquiries as well as entering it on your claim. You may print this screen if you would like a hard copy of the PA number. Once you hit the final submit, your request has been sent to the Interpreter Services request queue and cannot be edited by you or your staff. Important information to note. Contractors must not bill until the job has been completed. The agency's prior authorization review process has not changed, and requests will still be processed in the order they are received. If at any time you would like to check the status of your request, you will need to go into the PA Inquiry hyperlink on the provider portal. Enter the authorization number in the prior authorization number field, or use the criteria noted in the PA Inquiry screen. Please note you will get an error message for your request until it has been processed by HCA. It takes up to 2 business days for HCA to process a request. If it has gone past 2 business days and you are still unable to see the status of your request, you may email HCA's Interpreter Services Program for an update. Once the request is processed by HCA, your request status will show in the last box to the right. Below is a list of different statuses you may see on your PA and their definitions. Primarily, you will see requested, referred, and approved. Here is a list of additional resources. If you would like to see a list of current contracted agencies or interpreters, you can visit the ODHH website. Additionally, if you have any questions or concerns, you can always reach out to our Interpreter Services inbox listed here.